Welcome to your Healthcare Choice or Chance. It's been a long time, about a year since I've done the show, but there's so much happening with the hospital industry. What it is really the Wall Streeting of hospitals that we really have to talk about. Hospitals have become high profit industry, actually, and it has really impinged on us as patients. So today I'm going to do two shows. The first will be on a new act. It'll be a Transparency Act, which I'll get into in a few minutes. And then the second show will be about the Patient Safety Act. And I'm doing these shows because, guys, you have got to know what's going on. I mean, at one time or another, we're all patients in a hospital. And if we go in not understanding what's happening with the system, you know, you could be hurt very badly. So I'm doing these shows to educate you about what is happening with the hospital industry today, and it is not good, not only in Massachusetts, but throughout the country. And I am so happy to have with me my great and good friend, the king of healthcare reform in Massachusetts, Sandy Eaton. That's Sandy Eaton, a retired registered nurse from Quincy Medical Center, who retired a couple of years ago. And he was a critical care staff nurse there. He's been 50 years in the healthcare industry. He's had many, many roles in the industry. He's been on the board of the Mass Nurses Association. He has represented the Massachusetts Nurses Association on the steering committee of the labor campaign for the single-payer health care campaign. He's been the past chair of the Mass campaign for single-payer health care. Sandy has an AB degree from Boston College in philosophy and theology, and he writes on healthcare and nursing and related topics for Labor Notes, the Mass Nurse, the National Nurse, Peaceworks, Revolution, the Yankee Radical, and he's an editor, he is the editor of Sea Change Bulletin, which is a website that you can find very easily about nursing, healthcare, and labor activists. And Sandy, I am so glad you're here today. It is
my
just
pleasure
so great.
Always, Ellen, to be with you.
We have so much to talk about, don't we?
Too much.
It is really too much, and that's why we're doing these shows. We could probably do 20 million shows.
Well,
but we're only going to do
more.
two. We're only going to do two. To start off, we're going to be talking about the Hospital Profit Transparency and Fairness Act, or HPTFA. That's the Hospital Profit Transparency and Fairness Act. It's a real mouthful to say, but it is a very, very important act. And so, first of all, before we get into it, I'm going to ask you, why is there such a need for this?
Well, I trace, at least going back to 1991, when the Commonwealth passed the Chapter 495, the deregulation of hospital finance, and I would say every single so-called attempt at healthcare reform since then has led us down this path to where we have a system of haves and have-nots. Individuals who are well insured and well cared for, and others who aren't. Institutions, services, facilities that are very wealthy and stable, and a number of other facilities and institutions and services that have shut down, are threatened, are teetering on the edge. And it's totally unjust, and what kind of care you get, your chances of survival may well depend upon what community you live in, and the inequality that's built in. Right here in prosperous Massachusetts, and it's, of course, every state has its own little ways of tweaking health care. But even in Massachusetts, which is reputed to have the best health care in the world, I would call our system in Massachusetts dysfunctional.
And the thing that I must say, I still laugh with tears in my eyes, is how much money these CEOs are making. Folks, it boggles the mind where so many people, there are so many closings of hospitals and wards and departments that these CEOs, and here's some of the figures. I was surprised that Morton Hospital, owned by Seward, the guy there makes the most, $3.4 million.
Right, these figures might be a year or two old, but this is the trend. You know, it seems. What really gets me, though, is that our research and one of our favorite researchers, Judy Schindel-Rothschild, associate professor of nursing at Boston College, has done some very thorough studies recently, and she just reported out that there's no correlation between how much a CEO makes and the nursing outcomes, the healthcare outcomes of the patients in that institution.
Right.
They're paid for shrewd financial thinking and other factors, and they're not paid according to whether your chances of surviving a trip to their hospital is better or not. And I think that's the especially scary part.
And the average, according to this, of course, I'm very into CEO salaries, because they could be failing left and right.
Yeah, yeah.
And getting people who are sick or have to be readmitted and whatever, and still their salaries are not affected at all. They not only get a salary, folks, they get bonuses. So what this is reflecting is basically just the salary, but not the bonuses.
And most of these facilities are not for profit. And I'm telling people, and I do a fair amount of lecturing, what I always say is, I ask folks, what's the difference between a for-profit and a not-for-profit? The not-for-profit doesn't pay taxes.
Exactly.
So, but in terms of practice, it's at times very hard to distinguish. And since the rate of injury and death to patients that we've determined through national statistics has been going up exponentially ever since that danger to patients was first highlighted by the Institute of Medicine's study To Err is Human in 1999. They pointed out that up to 98,000 people die unnecessarily in U.S. acute care hospitals every year. Last year, ProPublica did a similar study, and it says that at least 210,000 people in this country die unnecessarily in our acute care hospitals, and the number may actually be as high as 440,000 a year. So things are getting worse, and the hospitals are demanding greater flexibility. They already have great maximum flexibility, and because they're going to solve the problems themselves. Just last night, the Hampshire Daily Gazette published a story covering the Commonwealth of Massachusetts assessment of what was going on at Cooley Dickinson Hospital in Northampton, where 2 babies died, and there are a number of other tragic scenario in their mother-child division. The state found that physician fatigue, nursing fatigue, improper staffing of physicians and nurses was a major factor in the demise of those 2 children and in the general poor outcomes in that unit. The hospital, admitting that there were problems, denies that staffing of doctors and nurses had anything to do with it. Well, we're looking at hospital transparency and fairness, and we're really going to get into that in a minute.
Yep.
But the parallel thing is also what we as nurses at the bedside have been fighting for a while now, and that's guaranteed safe staffing levels, enforceable.
And which we're going to talk about that in the next show.
Where we can prosecute and hold accountable those administrators and managers who cut staffing back in their warped thinking to save money. What they're really doing is endangering the lives of their patients, and that's criminal in my intent, and we should make it so.
And also the surplus, the hospital surplus in 2012, this is also, folks, I mean, it boggles the mind. Of course, if you're living in this country now with all the things that are going on with corporations, you say, why am I not surprised? However, this is endangering your life. So in 2012, the Massachusetts Center for Health and Information Analysis reported a surplus for hospitals of $1.286 billion, up 54%, I think was from the previous year. So with this kind of thing, and also the other thing that hands me a laugh with tears in my eyes, Sandy, is the Cayman Islands. Would you like to tell the audience about the Cayman Islands and hospitals?
Well, our researchers at MNA, that means the Massachusetts Nurses Association, so if I say MNA, that's the shorthand.
Right.
Have dug around and discovered something that we found surprising, shocking, that we didn't know. We have a list of 40 hospitals
and name a couple.
in Massachusetts.
Name a few, because I love it.
Well, all the way from Addison Gilbert up in Gloucester, down Newton Wellesley, North Shore Medical Center. I don't see Cape Cod Hospital on this list.
No, I don't see Cape Cod either.
Which is interesting, but
we've left out Beth Israel Deaconess Medical Center.
Beth Israel Deaconess.
Mass General.
And yes, most of the big teaching hospitals.
Tufts Medical Center.
Right.
Brigham and Women's.
Dana-Farber. They all have accounts, offshore accounts for which they're not accountable. In the Cayman Islands, almost everyone, Leahy Clinic is the only one that only has its money in Bermuda. Every other hospital on this list of 40 has money in the Cayman Islands, and several of them have them in several other countries.
And Boston, I just like to mention Boston Medical Center, not only has it in Bermuda, but also in Lesotho. which someone said, a doctor said to me, but Ellen, where is Lesotho? And I said, well, that's Africa, isn't it?
It's
It's
an
amazing, isn't
enclave
it?
within the Republic of South Africa.
Yeah.
Yes.
So, I mean, folks, these hospitals are very, very ingenious and very creative in how they're handling their money, I must say.
And I have to point out that you mentioned Boston Medical Center, and I'll say also the Cambridge Health Alliance, two of the premier safety net facilities. And all the other facilities have these accounts, and we don't know how much is in them. You'll note that Tenet and Steward, the two healthcare chains that are in Massachusetts, don't have these islands. Well, they send their profits to corporate headquarters, wherever that happens to be. But in fact, all of these not-for-profit hospitals have these accounts. They have to report, we're told, to the feds that they exist. They don't have to report to anybody how much is in them. And one of the features of the Hospital Profit Transparency and Fairness Act that will be on your ballot on November 4th. It's also in the legislature. I would be very surprised if the legislature took action before we file the final round of signatures in July. But that act will shine a light on all of these. It will also shine a light on the total compensation packages of these hospital CEOs. What we see reported are their salaries. In many cases, it's the other aspects of the compensation package that overshadows the amount of actual salary. And part of the other provision is not only to shine light on, but also to adjudicate, to enact a provision that would limit the amount that a hospital CEO can get in his total compensation package to 100 times what the lowest paid worker in that facility is getting. Now that seems like an awful thing, but if you look at corporate America, where the typical CEO makes 300, 400, 500, 600 times what the lowest paid worker is, you know, but these are not-for-profit facilities, supposedly there for the good of the community.
And also, folks, I don't know if you're aware of it, but having done all the research for the show, this is all taxpayer money. Most of their budget.
60% on average of the
It's
remuneration.
It's our money, folks, and we don't have a clue, not a clue, where their money is going. Not at all. We are just shelling out this money, and these CEOs are living quite nicely.
And the other aspect is the money is in the Cayman Islands. Wouldn't it at least be good if these monies were in our local communities, banks? So maybe the resources would be available for more home loans or whatever the folks in the community need out of those banking services. So it's being taken away from us.
Absolutely.
In several ways, and without accounting. And this is also we're in the middle. We're recording this show on May 19th.
Right.
The budget debates are now raging on Beacon Hill, and money hidden away can't be exposed to help the legislators determine how much in need various hospitals and health systems actually are in terms of how they divvy up the state taxpayers' pie in order to meet the healthcare needs of the communities in the Commonwealth. So it's duplicitous on a number of levels, as well as being unfair. So we're proposing in this bill that we establish a special fund into which we would claw back hospital profits. I know that they're not-for-profit. Anything over an 8% margin from the well-to-do hospitals into a fund, and also that those hospitals cough up what they're paying in extra money above that 100-to-1 ratio for their CEOs into a fund that would reimburse, that would strengthen to enrich Medicaid reimbursements to those facilities that don't have enough. Remember I said the haves and the have-nots.
Oh, absolutely.
That's a major problem, and that's something that we can deal with. Until such time as we have a single-payer system in the state, and we have a general, much more general fairness right across the board, where hospitals would negotiate for each year separately their capital expenditures budget, as well as their operating budgets with the state agency, a single-payer agency. That would allow us, until such time, this is a stopgap measure to try to bring some fairness. So that's the transparency and the fairness part of the bill. North Adams Regional Hospital in northern Berkshire
Right.
County went belly up in April with a 3 days notice given
And yet,
by its
yet there
CEO.
was profit there in that hospital.
Right. There was on the one hand extreme malfeasance by that board in terms of making real estate investments around the area without, in fact, well, they put the hospital at risk. And I'm wondering why that CEO and those board members aren't in jail right now
Right.
for violating public health law. They have to give 90-day notice to the community before they shut anything down. And two, there's another law that any employer of 50 or more people in the Commonwealth has to give a 60-day notice. So both of those were clearly violated, and there's a whole raft
Well, I have an answer for you, Sandy.
regulations.
I have an answer for you, and I know you have the answer too. Follow the money, and who do they know?
That's right. That's right.
That's
yeah,
right.
yeah.
So, but I'm going to stop you right here.
That's fine.
Because I'm going to talk about my lovely situation with a very well-known Harvard teaching hospital that happened to me this year, and actually got me to do these shows. Because, folks, if these things can happen to me, these billing situations can happen to me, who knows so many people, and does these shows, and has written a book on my wonderful, wild and woolly experiences at a Harvard teaching hospital called Ellen in Medical Land, which you can buy in Kindle, and you will read it and laugh with tears in your eyes. I will say one thing about my book. It is positive. You can get good health care, but you have to know, folks, what is going on in the healthcare system and how to handle it. The last chapter gives you tips on how to get good health care. So because this happened to me, I'm going to tell you about it, and again, you will laugh with tears in your eyes. In November of 2011, I got sick, and it wasn't terrible. I had a virus with some fluid around my heart. So I had to go to this Harvard teaching hospital to have the fluid removed, and this is what happened. First of all, I went to the ER to have it, them check me and see exactly what was wrong. They gave me all kinds of tests, and then they discerned that I had to have this little procedure. So they put me on Thursday night, after being in the ER all day, up in a room in the ICU. And the next day, they took out the little fluid, and by Monday, I was gone. I left. I was done. Okay. So I was there only a weekend, and then I had out-treatment care. Well, this whole thing lasted till about through December or January, and I figured my Medicare would pay for everything. Then in July, I got this bill, folks. 8 pages of bill, folks, and this is what we're going to get into, because the bill, the sum total paid by Medicare, just hold on to your hats because I could not believe it, was $42,182.54. 8 pages. And then on the right, it says patient responsibility, which is I, $1,132. $1,132 they want me to pay after getting $42,182.54. And I would tell people this, and they'd say, "You got to be kidding, Ellen. $42,000 for a weekend?" Yeah, and a few checkups afterwards. So I called Medics. I'm on Medicare, and I have Blue Cross Blue Shield as my Medics plan. And I said to them, "Why aren't you paying for this?" "Well, we don't cover deductibles because the $1,132 is a deductible." I said, "Oh, because I thought they'd cover everything." "No, they don't, folks. You better check and find out." So anyway, I didn't pay anything. I didn't even call the billing department of this Harvard teaching hospital. But finally, I got 3 more bills. And I called, and I said, "I can't pay this. I mean, you already got $42,000. And they said, "We're sorry. We can't do anything for you." Okay. Then I absolutely ignored the whole thing. And by January, I started getting dunning letters from their lawyer, who was a collection agency. And this went on for a year but I did not hear from him. He sent me a couple of dunning letters, and that was it. And then for 9 months, I never heard a thing. And finally, in January of this year, 2014, I got a letter saying if I didn't pay what I owed, then they may take legal action. Well, at that point, I said, to heck with this. So I wrote a letter. And this is what you should do, folks. If you think they're in the wrong and you should not be paying, and I am so strong in this because this has happened to me a couple of times, you must be in touch with the hospital. And who should you be in touch with? You're in touch with the president. That is the person who is in charge of things like this. And I wrote a letter to the president of this particular hospital, this Harvard teaching hospital, who referred my letter to the patient relations department, which, folks, means nothing. Nothing. You don't want to talk to the patient relations department. So then I wrote another letter inviting him to be a guest on the show. Well, within 2 seconds, I got a letter from the lawyer of this Harvard Teaching Hospital saying they had forgiven the 1,100. They had thought about it after reviewing my record and so forth, and they somehow hadn't followed the policies they should have in billing me. God knows what that means. So it was forgiven. The point of this story, folks, you must stand up for yourself. I've had more elderly people saying to me, but Ellen, you know, it was a matter of $50 or $60. I bought a cane. The cane wasn't any good. They wouldn't take it back. I mean, they tell me all these stories, and they just will shell out a couple $100. You must not do that. You must not do that. This is your money. And you don't even understand what it's for. Now, let me just read a couple things in this bill, because I have no idea what it's for. An amount of $1,990. Well, this is kind of clear. For critical care for the first hour. 1 hour of critical care, almost $2,000. It boggles the mind. It boggles the mind. Then, $920. This, I have no idea what it is. Limited 2D study. Do you know what that is? Do you know what that is? Exactly. Where in your life do you pay money on a bill and you don't know what it's for? You go into Macy's, you buy a sweater. You're paying $25, you know it's for the sweater. So why is the hospital industry different? Sandy, why is the hospital industry different, where I don't understand the thing on this bill? And one more thing. Oh yeah, $9,200, folks. $9,200. It says here, cath per min dash cardiology. I don't know what that is. That may be the operation of where they took out the fluid from around my heart, but I don't know. So the point of this show today is, folks, the hospital industry is no different from any other industry. They provide a service, you should know what it is, and you should know what you're paying your money for. And we're talking today about standing up for your rights, by writing the president of the hospital, by calling the president of the hospital. And when you send a letter to the president of the hospital, you send it certified. Make sure you know he or she received it and when. And then, if you don't hear from them, you follow up. Most likely you will hear from them. And if you hear from the patient relations department, that's no good. You want it from the horse's mouth, and you want it from the lawyer from the hospital. Why are they billing you this way? I cannot say enough. Now, in my case, because I know everybody and I do a show, the one thing they are afraid of is publicity. They do not want publicity. But you have power also. You can go to the newspapers. You can go to the TV stations. You can tell them exactly what has happened if you get no results from the hospital. Do not pay 1 cent. I'm so big on this. I am so big on this. Even 1 cent is your money. You don't let go of 1 cent until you understand. I remember years ago I was staying at a Hyatt Regency in Greenwich before all the to-do with the house help there. And I remember paying money for a glass of wine at the bar. And I had some change coming back to me. I think it was like 5 cents in pennies and everything. He doesn't give it back to me. I said, excuse me, sir, where's my 5 cents? He says, it was only 5 cents. He actually said to me, the bartender, it was only 5 cents. I didn't think you'd mind. I said, excuse me. That's my money. I want the 5 cents. Don't ever let anybody steal anything from you that you've worked very hard for. And that's why we're doing these 2 shows today, to tell you the hospital industry is no different. You don't understand what an 8-page bill means? You better find out. You work very hard for your money. Am I right or wrong, Sandy?
You're right. The hospital industry is different in the sense that the society expects it to be a charitable institution. It's exempt from paying taxes, and there's a high demand on it. And actually, it's been transformed. Any kind of healthcare these days is a business. It's high finance. It's driven by the bottom line. And the mere fact that we have 40 major not-for-profit hospitals in Massachusetts with accounts in the Cayman Islands or other offshore places hiding their, quote, profits, I still call them profits,
Absolutely.
I don't care, means that there's a different ethic involved here.
I can't believe it.
The
Let's
haves
talk about the
and the have-nots.
what just happened with the South Shore Hospital and in Lynn?
The thing about Partners, it has for a number of years been trying to acquire South Shore Hospital. Most of the patients at South Shore Hospital are from the towns to the south, along the South
Like
Shore.
Hingham, like Cohasset,
Yeah,
Situate.
Jerusalem Road and so forth. They
Right,
tend to
where
have
there's money.
They tend to have very good health insurance with good reimbursement rates, and so South Shore Hospital would be a great acquisition as we pursue this drive for maximum profits, which we don't call profits. The city of Lynn used to have 2 hospitals. It's a very diverse, working-class city, somewhat isolated. You have to travel to get out of it, and through roads that are generally pretty well clogged. I know I have friends up there and have visited, and it's a gridlock city, a little bit like Quincy during rush hour, or Boston for that matter. But Partners, there's now 1 hospital, Lynn Union, and Partners, I wouldn't have known this, I just happened to pick up on the internet, came across an article from the Lynn Item talking about the fact that Partners wants to get rid of acute care within Lynn Union, transform it into a psych hospital, which is a whole other ballgame, and yes, we need those kinds of facilities. But they want to get rid of it there, and that will increase their chances of getting permission from the feds and from the Attorney General and the others to take over South Shore Hospital. There have been legal resistance to that move to take over South Shore Hospital because it would create, Partners would look more like a monopoly, and prices would go up as they crowd out competition. So they figure, it looks to me, I'm not a mind reader, but it looks to me they want to get rid of the poorly reimbursed poor folks and the working folks up in Lynn so they can pick up the much richer patient base, the catchment area of South Shore Hospital in South Weymouth. And it looks like that's working, that ploy is going through.
The other day. Yeah.
That the restraints, they're still negotiating over it, but it looks like the restraints on their expansion, Partners healthcare expansion into the South Shore area are being lifted. So,
and let's just say quickly, what does this mean for our patients here? I mean, what does it mean for you? I think this is you have to understand this, and then we're going to get into what you can do, because it's very important that you know that you can do something. What does this mean for a patient, Sandy?
Well, you're at greater risk. If you're in an accident or get gravely ill, you want a full-service hospital there that will save you and that will get you back on your feet. And you don't want to necessarily get billed by it excessively, and quite frankly, with a single-payer system, cash up front will no longer be an issue. We'll all be contributing to it according to our abilities, and all will be getting back according to their real. So it's a very unequal, unjust system. What you can do about it. We're broadcasting on Monday, May 19th. If you happen to hear this broadcast or see this broadcast in the next day or two, I hope you can come to the State House in Boston at 11 a.m. on Wednesday, the 21st, to join nurses from across the state and the Mass Senior Action folks and all kinds of RLIs who are fighting for the hospital fairness, the Hospital Profit Fairness and Transparency and Fairness Act, and the Patient Safety Act, which we'll get into in another time.
And this is for you folks. This is for you. This is not for the nurses. Of course it is, because they want to do a good job, but it's to protect you. And there's another group besides the Mass Nurses Association, the Mass Campaign for Single-Payer Healthcare. Are they intimately involved with this too?
Yeah, the Mass Care Board a couple of months ago did endorse these 2 ballot questions that I'm talking about, and we're all on board going in that direction. This is all part of what I call healthcare justice. To create a just healthcare system, you have to address access, affordability, quality, and equality simultaneously. At the same time, win them all together, not play one aspect off another. Try to solve one set of isolated problems and create other problems everywhere else in the system, as has been the Massachusetts plan since 2006.
And someone like me who does this kind of work and knows intimately, and Sandy knows the system, we shouldn't be the only ones who understand what's going on, because we really are. I think we're in the minority. When I talk to people who haven't been sick, they have no clue. They could have 12 PhDs. Once they get into the hospital system, it's like the Twilight Zone for them. They have no clue what's going on. So you don't be one of those people. You get educated, because sooner or later, all of us are going to be in the hospital for one day or longer. With that, we're going to close this particular show, but now we're going on to part 2 today. We have more to talk about, and that will be the Patient Safety Act. Thanks, Sandy.
Thank you very much, Ellen.